Tell me about your symptoms before the surgery.
Before the surgery, my back was always hurting. I couldn't stand more than 10 minutes, walk more than 10-15 minutes without the pain hurting in my back.
1 to 10, how bad was the pain and how long have you had that pain?
Well, by the end of 10 minutes, it would be on a level of 1 to 10, 10 being the worst.
Mm-hmm.
It was about a 10.
Okay.
And I've had the pain gradually getting worse in the last 3 years.
Okay, for 3 years it's getting worse. Did you just toughen it up or what did you do for it?
Rested a lot.
Mm-hmm.
Kind of didn't get to do anything after that. I just took it easy.
Yeah, and I would like as well to ask your significant other, what did you notice in her life? How was her life and how was it in that time frame in the
It's,
last 3 years?
Very, it was really too bad. I felt very sorry for her because all the things that she loved doing, she couldn't
Mhm.
do.
Yeah.
Gardening, walking,
Mm-hmm.
that sort of thing. It was very difficult.
Dancing.
Yeah.
And dancing. We used to dance and
Many.
things like that were. It was
Yeah.
getting to the point where she couldn't enjoy anything like that.
Yeah, many times the whole life, not only for the person but for the whole family, just turns around dealing with the pain.
I felt
what-
very old.
Yeah. Now, so we didn't take you to surgery right away. What did we go through, you and I, before we took you to surgery?
You analyzed my condition.
Yeah.
We discussed it. And I had,
When was the first time we met? Do you remember that?
It was a year.
about a year ago.
About a year ago. And then in that year we did physical therapy, imaging, injections.
Did we do injections? I believe so, yes.
Yeah,
Mhm.
yeah. And then as well, did we do a discogram?
Yes, we did a
Okay.
discogram.
So we went through all the conservative therapy, and then we confirmed with the discogram that your pain is truly coming from those levels that we were thinking causing your pain. And then we decided on the surgery, and I talked to you about the surgery and risk associated with that. What did I tell you before the surgery? What do you remember?
Why, let's see. Well, you did explain the risks,
Mhm.
all the risks that go with any kind of surgery
Mhm.
that a person would have, the possibilities of any residual pain, that
Mhm.
things that might not work, and things that would work. I did read your internet thoroughly, so I went
Mhm.
through all your forms and all your
Mhm.
information and all the reviews of past patients. And I was really excited with that information. I read everything about you, all your background, and I was very impressed. So,
But we specifically talked about the risk of a nerve root irritation.
yes.
Okay.
Yes.
What do you remember? What did I tell you, and how did you get more information regarding that?
Well, when you talked about that, I might have residual nerve pain,
Mhm.
especially down on the left side, because you would have to move the nerve over. You
Mhm.
don't cut it; you would just move it out of the way while you do the surgical procedure. That nerve would be irritated, and I might have some irritated nerve down my left side for a
Mhm.
while, and that it may go away at 100%, and it may not.
Mm-hmm. And you read as well that the information, the documentation that we provided to you, and but lo and behold, you had that nerve irritation.
I did, yes.
Okay.
I would have been more worried if I had not read your article on your
Yeah.
website.
Yeah.
Because it was excruciating pain down the
Yeah.
left side.
So
In fact,
explain
it
to
hurt
me.
more than the back, than the surgical.
Yeah, explain to me. I'm going to go a little back so I can. I want you to describe it and show it where that pain was, how it was, and so on. And
Well, I was having a lot of pain down when I was the next day in the hospital. It was down the outside of my leg here,
Mhm.
and all the way down my left side
that is
into my
L4 and L5.
into my foot, in the top of my feet, and the
Mhm.
bottoms of my feet, and on the
Yeah.
outsides. And so I was on pain pills for a while, and sometimes the pain pills didn't work very well. But it
Mhm.
seems like every day that went by, it would get a little bit better and a little bit better. Now I'm about 30 days after the surgery, and
Yeah.
it still hurts a little. It doesn't hurt up above, but the side is still sensitive to the touch.
Mhm.
Feels like a really bad sunburn.
Okay.
And it's delicate to the touch, but I'm taking a Tylenol or sometimes half of a pain pill, and
Mhm.
it seems to help a little
Yeah.
bit.
And we talk about it as if the surgery was about a year ago. The surgery just was about a month ago.
Yes.
And you're telling me that yes, you had that nerve irritation, But you had as well pain on the other side, on the right side.
I
How's that
did.
pain?
The pain on the right side is completely gone.
Right after the surgery, or how long did it
Right
take
after
it
the
off?
surgery, I had it for 3 years, and all of a sudden it's just nothing. There's nothing there anymore. I was very
Yeah.
excited.
And the reason you have the nerve root irritation is because I had to push it to the side, exactly as we described. And we described that as well, that down the road it may get worse few days when the swelling of the surgery get worse, but then usually after 4 to 8 weeks start getting better. When it start getting better, people sometimes describe like the sensation like electricity. Can you describe how is it right now? You say it's getting every day better, but when you have that still pain, how does it feel? How is it?
The best way to describe it is it feels like a really bad sunburn that you can't even touch. It's very, very sensitive to the touch. I sleep with a pillow on my feet because I have to keep the sheets off of my toes because it hurts. If you've ever had a really bad frostbite and you try to thaw your skin out really quick, that burning sensation, that's what it feels like.
Okay. Or you said that your pain was up to 10 before the surgery in the back. How is the back pain now?
On the back right now, it's like a half of a 1.
Half of a 1. And the right leg pain as well. How bad was it then? How bad is it now?
It was a 8 to 10. It was terrible, and right now it's nothing. It's half of a 1.
Half of 1. What about the left-sided pain? How bad is that?
The left side, it's about a 4 to 5 right now.
Okay. So overall, do you think it was worth it, the surgery?
Absolutely, thank you.
You're welcome. Now, what do you notice just in the last month, comparing to last 3 years and the last month? What do
Well,
you notice?
Initially, after the surgery,
Mhm.
she, and it's understandable that she's going to be in a lot of pain from the surgery. And with her issues with taking a codeine narcotic product, the nausea and so on made it especially difficult.
Mhm.
But due to the really wonderful anesthesiologist here, that went surprisingly well.
Mhm.
And a little patch behind her ear
Yeah.
for the nausea, again, wonderful. She was able to take her pill and, because of that, feel better because of the pain, of course. When the pill wears out, and if she tried to extend the time, then of course it was difficult to play catch up with that pain. But every day, less and less and less, fewer meds, more Tylenol in lieu of the
So,
other things, and walking. Now she can get around a little bit. I try to not allow, trying to keep her.
now it's good to monitor. It's good to have
Calm
a
down.
Yeah, because I think it's a little too soon to get too involved with certain things.
yeah, it is.
But she's
But you
doing
notice
well.
improvement
Oh,
already.
absolutely,
Okay.
absolutely, and a willingness to try to do things,
Okay.
and slight walking. She's going to
Okay.
be good.
Well, I think that's what I was expecting to hear. Okay. Well, thank you so much for the interview.
You're welcome.